We are live.
Good afternoon. Thank you all for being here. I am Melanie Griffith and have the honor of serving as the chair of the Senate Budget and Tax Committee's Health and Human Services Subcommittee. Here with my colleagues, Senator Addie Eckert, Senator Jim Rosapep, who's the vice chair of the committee, and Senator Ron Young. We make up the subcommittee. We've been meeting all session with our colleagues from the House, but we have the opportunity this afternoon to consider the recommendations that the analysts have made and the presentations by each of the agencies, and we'll be today making decisions on our recommendations to the full Budget and Tax Committee that will be shared later this week. So with that, today is Thursday, March 18th. We have phenomenal committee staff that's been working with us all session and some really dynamic analysts that have provided this information for us. So with that, I think Ms. Pedersen, I'm not sure who's getting us started, Philip. Is it you, Ms. Pedersen?
It is, yes.
All right, good afternoon.
Thank you, Madam Chair. So I will start you off with the first agency and budget code order. That'll be on page 1 of the document, the Office of the Deaf and Hard of Hearing. The first DLS recommendation is to adopt narrative on sign language interpreter complaint data. The agency concurred and the House adopted.
Concur with the House.
Second.
We have a motion and a second to concur. Any questions? That we will concur with the House decision.
Moving on to the next agency, the Department of Disabilities, starting on page 2. The first DLS recommendation is to adopt narrative on the statewide IT accessibility initiative. The agency concurred in part, but requested some modifications to the narrative. And those modifications, the House adopted the narrative with the requested agency modifications as shown below, starting on page 3 and going on to page 4.
We would concur with the House and their modification.
Second.
Okay, we'll concur with the House and their modification. Any questions? Okay, that recommendation is adopted.
Going on to your third agency, the or budget unit, the Executive Department, Boards, Commissions, and Offices starts on page 5. The first DLS recommendation is to adopt narrative on small business reserve and minority business enterprise liaison vacancies throughout state agencies. The agency concurred, but the House modified this narrative slightly to also request some additional information. And that modification starts on page 5 and goes on to page 6.
Okay. I'll move we concur with the House modification.
Second.
Okay, any questions? We'll adopt and concur with the House modifications.
The next action in this budget unit, the House adopted narrative on agency minority business enterprise participation attainment, requesting the Governor's Office of Small Business Affairs conduct a survey of state agencies. That starts on page 6 and goes on to page 7 and 8.
Recommendation?
Can we modify to postpone that survey a month?
Second.
Okay, so recommendation is to modify and postpone the survey by 1 month. Any questions? Okay, that's what we'll do. That recommendation is adopted as the senator presented. Okay.
Thank you.
The next item should be the Secretary of State's office. The recommendation was to concur and the agency concurred. The first House adopted.
Concur with the House.
Second.
Okay, motion and second to concur. Any questions? That recommendation is adopted. We concur.
Your next agency starts on page 10. The first action for your consideration is the DLS recommendation to adopt language requesting data on program waitlists and also data on the agency's two new programs, the Community for Life program and the Durable Medical Equipment program. The agency concurred in part but disagreed with the restriction of funds. The House modified this language as shown starting on page 11 and then going on to page 12 that some additional data on the new programs also be asked for with this language.
Concur with the House modifications. I think we had a lot of discussion on this and just a general statement, trying to balance, the new initiatives presented with the very pressing needs of our increasing aging seniors through COVID. So thank you.
We have a motion to concur with the House modification. Is there a second?
Second.
Okay, any questions? All right, we'll concur with the House modification.
The next DLS recommendation for your consideration starts on page 13, and that is to reduce the allowance for the Community for Life program by $300,000 general funds. The agency disagreed and the House adopted.
Move we concur with the House.
Second.
We have a motion and a second to concur. And question, that recommendation is adopted.
The third DLS recommendation for your consideration is to level fund the Durable Medical Equipment Reuse Program with fiscal 2021. The agency disagreed and the House rejected this action, and instead, as shown in the additional first House action number 1 on page 13, they chose to restrict these funds to instead be used to reduce waitlists and other state programs.
Which has been an ongoing increasing need, isn't that correct, Grace?
Yes, there are
For
wait
the
lists.
wait list, we've had a lot of discussion about that. And that's been a major, major concern from all of our jurisdictions, I believe. So I'd concur with House.
Second.
I have a motion and second to concur with the House. Any questions? That recommendation is adopted.
Okay, and then the final DLS recommendation for your consideration is on page 14 to adopt narrative requesting information on the department's coordination of durable medical equipment donations and the distribution of that equipment. The agency concurred and the House adopted.
Okay.
Concur
Move we
with
concur.
House. Yeah,
Second.
second.
Motion and a second to concur
Or
that
an echo.
that action is adopted. Okay.
Okay, then there were some additional first House actions starting on page 15. The first one is to the House adopted narrative on requesting a report on affordable senior housing.
Okay. I move we modify with the due date changed to November 15th, 2021.
Second.
Okay. So a second to modify the House recommendation, change the due date to November 15th. I think I heard everyone. So that action, that action is adopted with that modification.
Can
Yes.
I just make a comment on this?
Sure.
We had a lot of discussion as we went through the hearing on the budget and when this was added, and just had to go back and revisit the whole mission of the Department of Aging and who needs to be involved and how we do an assessment. So we concluded that we could do this with that modification. Right?
Yeah, thank you. I think this is important information for the state to have, but agree that giving them a little more time to produce. So that action is adopted.
The third first House action for your review is restricting funds in the Department of Aging and the Department of Health pending receipt of a report on the state's plan to accommodate the cognitive health needs of the state's aging population. That's on page 16 and goes on to page 17 and 18.
And that, Grace, that's a joint venture, right? I believe behavioral health has been collecting a lot of this data so that once again, in looking at the increasing needs of our senior population, this would be an important part, probably even to include in the Department of Aging's plan. Don't they have a plan that's due?
They do. They will submit a new state plan on aging at the end of the current fiscal year to take effect in the following federal fiscal year.
Right, and would this become a part of that?
The language as adopted by the House requests that this be submitted as an addendum to that state plan so that they will be doing it at the same time. And you're correct that the Behavioral Health Administration would also be a co-author on this report.
Right, because I know they've been working as a member of the Behavioral Health Advisory Committee. I know a little bit about, some of the information that's been gathered there. So thank you very much. Yeah.
Thank you. So I entertain a motion on that recommendation number 3.
Concur with the House.
Second.
Okay, motion and a second to concur with the House. Any questions? Okay, that action and concurrence is adopted.
Okay, and then there are 2 more actions for your consideration. They're color page items starting on page 18 and then going on to page 19. These 2 items are related. They restrict funds provided in supplemental budget number 2 for home delivered meals to be used at the discretion of area agencies on aging. The first color page is effective for fiscal 21 and the second one is effective for fiscal 22.
Grace, have we heard from the local jurisdictions about the increasing needs? I know in our area, I've heard a lot about it. And when you did your assessment as well, and did we hear from other folks about it?
I believe there was testimony on this, these issues for the budget hearing. I could follow up with you with some more information from the locals.
Okay. I know it's been, just general food services have been a major issue. And I know Secretary was doing some innovative programs, but it's a matter of how do we balance all that out with our most vulnerable citizens. So thank you.
Thank you. And I don't remember, but I believe this is not the sum total of their funds for meals. Is that correct?
That's correct. The state receives a base allocation from the government for home delivered meals, and this is only a portion of the risk recovery funds provided in fiscal 20.
Okay, great. Thank you.
Was
Move
there-
to adopt. Yeah, move to adopt.
Second.
I have a motion and a second to adopt the language on page 19. Any questions? That language is adopted.
The next agency is the Maryland Commission on Civil Rights. There was one recommendation for adopting committee narrative requesting an update on open pending cases and case processing times. This was slightly modified by the House to add a section at the end, additionally requesting a comparison on case processing times to similar sized jurisdictions in other states.
Okay.
Concur with the House modification.
Second.
Okay, a motion and a second to concur with the House modification. Any questions? That action is adopted.
For the military department on page 22, DLS had recommended to concur with the governor's allowance. However, the House had chosen to adopt 2 color pages. The first is on the bottom of page 22. It requests information on the Free State Challenge Academy for at-risk high school youth and ask for some more information related to the of COVID and how they plan on continuing that program moving forward.
Concur with the House.
Second.
Second.
I have a motion, a second, and a third to concur with the House action. And so that action is adopted.
Okay, the second item is on page 23. It's related to the Amos Fund and it asks for information related to the disbursements for the Amos Fund, but also information on how the maintenance of effort requirement has been applied and any penalties associated with that maintenance of effort requirement.
All right.
Concur with the House.
Second.
I have a motion and a second to concur with the House decisions. Not seeing any questions, that action is adopted.
Okay, the last item we have begins on the bottom of page 24 and continues on to page 25. This was language that requests MEMA to convene a task force to counter domestic terrorism in the state, and restricts a portion of the federal money available for Homeland Security needs, and restricts that money to be used at the discretion of recommendations that have been put forward by this task force.
Okay.
Good.
What's your pleasure?
Dom? Oh, sorry.
No problem. Is there a second?
Second.
Second.
Okay. Okay, that action is adopted. Yes.
We have, I'm sorry. Oh, yeah, we do have a reporting requirement in there that we will get that information in November. Thank you.
Yep, there's a reporting requirement attached to it as well.
Oh, yeah, right.
Yep.
Right. Good catch.
Thank you.
Mhm. Okay. Adopted.
All right, on page 27, we have MIMS's budget. DLS initially concurred with that, and the House adopted that concurrence. However, we do have an additional item for your consideration here. This is a budget language requesting a report sort of on the state's emergency planning, particularly looking at the COVID crisis and how well prepared we were for that, and then for the public health preparedness going forward.
So this is a review. This is a retrospective kind of
Correct, yes, Senator.
assessment and review of where we set up, where we able to meet whatever the criteria and goals established with adequate resources. That's what we would have in here.
Correct, and MIMS is the author, but they are also asked to engage with the health department, MEMA, as well as the private hospitals.
Okay, so we would reject the House's motion, or right, or whatever they decided, and then we would adopt the color page item.
Correct.
Okay, so I'd move that.
Okay. Is there a second?
Second.
Okay, so the motion is to reject the House decision and adopt the language that was described regarding the report due on December 1st. Any questions? Okay, the Senate action is adopted.
On page 29 is the first action for the Maryland Health Benefit Exchange. DLS recommended that the agency notify you if they submit any applications for state innovation waivers or receive any decisions on those. The agency concurred and the House adopted.
Concur with the House.
Okay, there was a motion and a nod, and then a second. Okay, any questions? All right, that concurrence is adopted.
The second recommendation, which continues on to page 30, requests a report on the final 2020 plan year payments and an updated forecast for the reinsurance program. The agency concurred and the House adopted.
Concur with the House.
Second.
Okay, and, seeing no opposition, that concurrence is also adopted.
On page 30, there was one additional piece of narrative that the House adopted. This requests the Health Benefit Exchange to review options for providing coverage and cost sharing for individuals who aren't eligible for Medicaid or qualified health plans.
Concur with the House.
Second.
Okay, any questions? Okay, that action is adopted.
On page 31, there are a few BRFA items related to the Health Benefit Exchange. Item 9 requires the transfer of $100 million in each fiscal 2021 through 2026, a total of $600 million from the provider assessment for the reinsurance program to Medicaid. And there's $100 million general fund reduction, contingent general fund reduction in Medicaid for each fiscal 2021 and 22 on related to that action. The House modified that to make those transfers only in fiscal 2021 and 2022.
Would concur with the House's decision on that one.
Second.
Yeah, motion and a second to concur with the House, seeing no objection, that concurrence is adopted.
DLS made a recommendation for a technical amendment to that provision to clarify that the funds can be transferred from funds that have already been received, as well as new revenue, and clarify who is responsible for making the transfer, and the House adopted that.
Okay, concur with the House.
Second,
Okay, motion and a second to concur on, that's item 9.
9 technical.
9 technical. All those in favor? Aye. Okay.
Aye.
All right, just thought I'd change it up a little bit and make sure
all
you
right,
all
awake.
that concurrence is adopted.
Item 10, there's a provision to reduce the mandate for the health benefit exchange from 35 million to 32 million. There's $3 million of general fund revenue assumed as a result of this action in the budget plan. The House adopted that provision.
Concur with the House.
Second.
Okay, I have a motion and a second to concur. Seeing no objection, that action is adopted.
On the bottom of page 31 and continuing on to page 32 is an additional item for your consideration. This is a narrative that requests the health benefit exchange in consultation with the Insurance Administration and the Health Education and Advocacy Unit of the Office of Attorney General. Submit a report on the prevalence of high deductible plans and cost sharing obligations and perceived consumer knowledge and impact on utilization of those kinds of plans.
Adopt the narrative.
Second.
Okay, motion and a second to adopt. Seeing no objection, that action is adopted.
And that's all for the health benefit exchange.
Mhm.
Thank you.
Thank you.
Next is the State Department of Assessments and Taxation on page 33. The first item is committee narrative on tax lien sales held during calendar 2021. The first House adopted.
Concur with the House on that.
Second.
Okay, motion and second to concur. Seeing no objection, that action is adopted.
The second item is requesting narrative on staffing in the real property valuation division. The first House adopted.
Concur with the House.
Second.
Okay, motion and a second to concur, and seeing no opposition, the Senate will concur on that action.
There is one BRFA item for this agency on page 35. This is the proposal to increase the local cost share for SDAT administrative expenses, and the House rejected this provision.
Concur with the House. Reject it too.
Second.
With an explanation point at the end.
Yes,
Seeing no
yes.
objection, we concur with the House on that recommendation and action.
We began the health department on page 36 with the Maryland Department of Health Administration. DLS concurred with the budget as introduced. However, the House added two items. The first one is language requiring a report on a mass vaccination site in Montgomery County due July 1, 2021. They're restricting $1 million until this report is submitted.
Okay.
Concur with the House. I think that was an important item to the folks in Montgomery County, correct?
Second.
So are we on item 1 or are we on the language, Mr. Garrison? Just to be
The language, considering
Oh,
that.
sorry.
Yeah, if I could, ask the subcommittee, maybe
Mixed up.
want to take another look at that recommendation from the House on that.
That's a little high.
Senator Rosa Pep, I see you unmuted. Was there something you want
I'm here. I'm just listening hard.
Okay.
Yeah, but do we need to restrict 1 million? Is that what this,
Oh,
I think that's a little steep. Can we modify it?
You can.
Okay, move to modify, to only restrict half of that, 500,000.
100,000. Second.
Okay, the motion and the second is to modify the first house action and restrict 500 versus the 1 million they restricted in this section of their language. Any opposition to that modification?
Mm-mm.
Okay, so the Senate action will be adopted.
And then on page 37 and continuing to the following, the House does have another piece of language that they added. This also restricted funding pending a report. They only restricted $100,000 for this report, and it's about vacancies throughout the department. There's several aspects of the health department that have high vacancy rates. And so this asked them to submit a report, including salary reviews and the impacts of recent changes to compensation plans.
Concur with the House.
Second,
A motion and second to concur, not occur, concur, seeing no opposition, will adopt that action.
All right, and then on page 39, we have the Office of Healthcare Quality. Here, DLS concurred with the budget as introduced. The agency concurred with that, and then the House also adopted.
Concur with the House.
second,
A motion and a second, seeing no opposition, that action and concurrence is adopted.
We begin the health occupation boards on page 40. DLS had a recommendation for a piece of narrative around the a major IT project that has been stalled. The agency concurred with this, and then the House also adopted this narrative.
concur with House on this one. We've been following that. Thank you.
The BRFA actions that pertain to the health occupation boards start below that and continue on to page 41.
I apologize, just a second. I don't think we adopted item number 1. So I heard a motion. Can I get a second?
Second.
Okay, so seeing no opposition, we'll adopt item 1 and move to the BRFA actions.
Thank you, Senator. So the BRFA actions, the governor introduced his budget with 3 BRFA actions related to health occupation boards, all of which transferred funds from excess fund balance to offset general fund spending elsewhere. The first one listed is actually item 28, and this took $6 million from the Maryland Medical Cannabis Commission to offset general fund spending in behavioral health. What the House elected to do was just take half of this amount and authorize a transfer of $3 million versus 6.
And if I could just refresh our memory, Mr. Garrison. So there was, this was a governor's recommendation to take the 6 initially? In the
Mhm. Correct.
Okay. Well, let's move it up a little bit and modify to authorize a transfer of 4 million.
I just have one question. Do we know what that transfer to behavioral health was for?
It is currently, there's a contingent reduction attached to it on the community services spending. So on the provider reimbursement side, it would offset general fund spending there, which is generally for the kind of state funded or some other aspects of provider reimbursements that don't have that Medicaid match to it.
Got it. Yep, I'd second that modification transfer 4 million.
Okay, so we have a motion and a second to authorize a
Thank
transfer
you.
of $1 million. I see no objection, so the Senate action is adopted.
On item 27, again, the governor introduced a $2 million fund balance transfer that was also targeted towards BHA as well, again, to those community service provider reimbursements. Here, the House elected to take the full $2 million as well as introduced by the governor.
Mhm. Let's modify that to the amount to just transfer 1.5 million, make a difference.
Okay, I'll second that.
Okay, so a motion and a second, seeing no objection, we'll modify the authorized transfer to 1.5 million.
And then for these next three, I'm going to discuss them all together. So DLS had some concerns about the fund balance transfer of $500,000 from the Board of Pharmacy. The governor was targeting this towards the Office of Controlled Substance Administration, but the Board of Pharmacy actually had a transfer authorized as well in fiscal 22 that wasn't necessarily accounted for in the governor's budget as introduced. And so if this transfer went through, as well as the prior authorized one, DLS was concerned about the fund balance. What we recommended was to strike that provision entirely, and then to offset that with the transfer from the Board of Psychologists, and that transfer is recommended at $700,000. What the House did was take the DLS position in that, so they did reject the governor's transfer, strike, adopt DLS's provision to strike that transfer, and then take the offsetting amount plus some from the Board of Psychologists.
So do we, okay. So why don't we concur with the House and reject 26? Concur with the House to strike that provision, and then to reject, make a difference with the House on number 101, the transfer of the 700,000.
Okay, second.
Okay, there's a motion and a second to concur with the House on 26 and 26 DLS and reject item 101, which is the transfer of 700,000. No
Correct.
objection. That will be the Senate action.
Okay, good.
All right, and then still on the health occupation boards, we have two color page items for your consideration on pages 42 and 43. The first of which also pertains to the fund balances that we were just discussing. Given the Board of Counselors and Therapists did accrue a sizable fund balance, what this narrative asked them to do is review their fee structure to hopefully prevent larger accruals again.
That's good. We've been working with that over time to make sure folks don't get a lot of their money taken for other things. I mean, and the purpose of having professional fees is to offset the work that the boards do for them to benefit all of us. So I would adopt that language. Let them take a look at that. Get back to us. It's back in what, October 1st. That'll work. Thank you.
Excuse me, I'll second that.
Okay, so we've got a motion and a second. Seeing no opposition, that action is adopted.
And then our last item here is regarding the Board of Nursing, and it's looking at their workload and the accuracy of their staffing, particularly to meet any increased demands on them in COVID-19, as well as any additional workload that may have been added from a sort of recovery standpoint. This report is due October 1, 2021.
I'll move to adopt. Yeah, and there are several bills moving through that may also increase their workload. And I'm concerned about, we've had ongoing concerns that they be responsive regarding licensure, and we added the CNA piece this year. So that is a major concern. So they'll get their report. That'll be helpful. Thank you.
Okay. Second that.
Thank you. On this recurring conversation topic of the subcommittee, I have a motion and a second and see no objection. So that decision is adopted.
So then that brings us to the Public Health Administration on page 44. The DLS recommendation is to adopt narrative on public health personnel and vacancies. The Department of Health requested a January due date, and the House granted that later due date by modifying this narrative that you can see on the bottom of page 45.
We concur with the House modifications.
Second.
Okay, motion is to concur with the House modifications, and it's been seconded. I see no objections, so that action is adopted.
Then that next up would be on page 47, the Prevention and Health Promotion Administration. The DLS recommendation was to concur with the allowance. The agency concurred with that, but the House instead adopted the first piece of language on page 47. So that language restricts funds for a grant for the Center for Infant and Child Loss at the University of Maryland, Baltimore. So Sorry, that's it on that item.
So we want to concur with House on that.
Okay,
Yeah, I'll second that.
a motion and a second to concur with the House on item 1. No opposition, that action is adopted.
The House also adopted a piece of narrative on page 47. This is requesting a report on educational and outreach programs related to diabetes, and specifically the racial disparities in diabetes prevalence.
Concur with House. That's been an ongoing priority for the department. So that shouldn't be that difficult.
Definitely second that.
Absolutely. That is another recurring conversation with the subcommittee. So the motion and the second is to concur with the House on this item. Seeing no opposition, that action is adopted.
On page 48, there's a new item for your consideration. This is language that would be placed on the fiscal 21 deficiency in the second supplemental budget. That supplemental budget added federal funding and federal aid for the vaccine distribution. So this language has kind of 3 pieces of legislative intent on vaccine equity and how doses are administered to or allocated to counties. The second piece is about collaborating with community-based partners to help with vaccine access. The third piece is also on vaccine accessibility for people who struggle to get to vaccine sites and who are having a hard time with the sign-up process. And then it also withholds funding until MDH provides a report by April 15th on the vaccine distribution process.
I move we absolutely adopt that.
It's a lot. Second,
Okay.
a lot by April 15th.
Yep, there's a motion and a second to adopt that language regarding the federal appropriation. I see no objections, so that action is adopted.
So then the last item for the Prevention and Health Promotion Administration is on the bottom of page 51. This is the exact same language, but would apply to fiscal 22 as well, since that supplemental budget provided some funding in fiscal 22 also. And so there would be a follow-up report on the same information, and that would be due in July.
Okay, move we adopt.
Second, that's short turnaround. All right.
It is.
Because the first report's due April 15th, and then this one's a couple months later as we're wrapping up the year.
Right, on different pots of money though, correct?
Right, right.
Okay, I have a motion and a second on these reports, so I see no objection. That action is adopted.
On page 55, we have the Behavioral Health Administration's budget. And the first item here was a DLS recommendation around the assisted reconciliation process. And what the House did that starts on the next page is they modified that, both refining some of the reporting requirements that DLS identified, as well as adding 2 other components to it. One looking at the department's use of a sort of reconciliation mediator in this assisted reconciliation process, considering the overpayments, as well as asking the department to sort of outline what contract management steps they used and in fact didn't use when assessing damages to the behavioral health ASO.
I'd concur with the House's modification on that. This has been quite a challenge. Quite a challenge.
Have a motion and a second on this challenging issue that the subcommittee has been dealing with for about a year. So I see no objections, that action is adopted.
The second item is on page 57 and continuing to the following page. And this restricts $500,000 pending a report, particularly focused on psychiatric rehabilitation programs. This is both following up on a report that was requested last year that had yet to be submitted, as well. Additionally, when DLS did their analysis of the overpayments and underpayments, PRPs were fairly prominent in that. And the MDH concurred with this and the House adopted it.
I repeat my previous remark, entertain a motion.
Concur with the House.
Okay, I got a motion and a second. That action is adopted.
The third DLS recommendations on page 28, or 58 rather, sorry. And this is also pertaining to the ASO, and this is now forward-looking, asking the department to get with the providers and identify what needs to happen to have a functioning ASO, and then provide a series of reports on when those steps have been met. The agency concurred with this and the House adopted it.
Concur with the House, definitely.
Second.
Right, so we concur with the House, the recommendation, the agency, and that recommendation is adopted.
You know, Madam Chair, I was just thinking one of the nice things about having our briefings together is that we kind of knew where folks were going to go with some of their decision and language. We don't always have that opportunity because we meet separately. So that was kind of a change this year.
Yes, absolutely.
Seems like it's probably much smoother this way.
I don't know. We haven't made it through. We'll see when we get to
Pros and cons.
Okay. Item 4, I think.
Correct. So this is annual language. What it does is it makes sure that the provider reimbursements for BHA stay within those programs. The agency concurs with this and the House adopted it.
Yeah, concur with the House.
Second.
Okay, motion and second to concur. Seeing no objection, that action is adopted. That language is adopted.
The fifth item here is contingent language that was added by the House, or that was added by, it was under the DLS recommendation that corresponded with the Board of Psychologists transfer on the BRFA items that we discussed in the Health Occupations Boards. And because the House did take the DLS position, they did adopt this language.
So to be consistent, we would probably want to
Reject it. Yeah, let's reject that. As we dealt with that, yeah.
have a motion and a second to reject that item.
Items 6 and 7 are the two other aspects of our annual language here in this program. Again, keeping the provider reimbursements within. MDH concurs with this, and then the House adopted both items.
Concur with House on both items.
Second.
Motion to concur and a second. Those actions are adopted.
All right, we are in the middle of page 61, and here we have a $35 million general fund reduction. This is due to availability of enhanced federal fund match, and the agency concurred with this, and the House adopted it.
Concur with the House.
Second.
Okay, that's a motion and a second to concur. No objection, so that item is adopted.
Further on reductions, DLS had a recommendation on the fiscal 2020 accrual. DLS has a BRFA item that would recognize a $5 million general fund surplus there in their accrual. The agency disagreed with this, but the House did adopt it.
Concur with the House.
Second.
Okay, motion and a second to concur with the House on this BRFA item. Seeing no objection, that concurrence is adopted.
All right, the House did also add another piece of language to the BHA budget that starts on page 61 and contains the following page. This is around the institutions for mental disease designation in certain state psychiatric hospitals and their ability to claim Medicaid funding.
Yeah, they're going to look into that. Yeah, concur with House on that.
Second.
Okay, motion and second, and we will concur on that language.
And then starting on page 62, we have 3 additional items for your consideration. The first of which is narrative on the infrastructure system that is to be used with the Greater Baltimore Regional Integrated Crisis System Care Traffic Control System. This is a new grant program that was under the Catalyst grants for the HSCRC that is starting this year, and this asks the department to look at how to engage the provider community in participating as well.
Move we adopt it.
Second.
Second.
Okay, I have a motion and a second to adopt. Seeing no opposition, we will adopt that action.
The second item on page 63 is on the implementation of a new suicide hotline. The Federal Communications Commission is authorizing 988 to be the new National Suicide Hotline. And so this asks the department to look at the implementation of that.
Move to adopt.
Second.
So I have a motion and a second to adopt that narrative. Seeing no objection, that narrative will be adopted.
And then lastly, on BHA, on page 64, we do have another piece of language for your consideration. What this is under the most recent stimulus bill passed at the federal level, there is an enhanced match for home and community-based services in the Medicaid program. And so this piece of language does two things. First of which is that it makes sure that any money, any additional general fund savings from that enhanced federal fund match stays within those provider categories that we discussed above and restricted with annual language. And then also it does ask for a report. The request for that report starts on page 65. Both asking the department to separate out that funding and to identify, so we can identify sort of the dollar amount that they ultimately did receive there.
Okay, so just to refresh, Mr. Garrison, this action would include language from page 64 and 65 to a report on page 66, correct? Is that
yes,
all connected?
Yes, the information request does just tail down there to 66. Yep.
Okay, is there a motion?
Move to adopt.
Second.
Yeah, motion and a second to adopt that item. No opposition, so that action will be adopted.
All right, so then next up would be the Developmental Disabilities Administration, beginning on page 67. This first item was a DLS recommendation to restrict $1 million until DDA provided a report on the LTSS transition. DDA concurred with the report, but requested a December 1st due date. However, there is actually some kind of a modification to this language for your consideration. If you look at page 70, that's where the difference is. You can see item 6 adds an additional information request on one of DDA's requirements that the LTSS system be upgraded to allow for uploading from the providers.
I like that language. So I guess the motion would be that we'll modify the House language and adopt the color page number 1. Is that correct, or am I on the wrong one?
That is the
That's
motion.
correct.
There a second?
Second.
Okay, so a motion and a second, seeing no objections, that action is adopted, including the item 6 on page 7.
On page 71, item 2 is another DLS recommendation for narrative on DDA's state facility performance measures. It requests them to start presenting that data separately for each facility in next year's MFR submission. DDA concurred, the first House adopted that.
Concur.
Second.
Okay, I've got a motion and a second to concur, no opposition. That action is adopted.
Item 3 that begins on 71 and goes on to 72. This is language that restricts the community services budget and DDA to that purpose and wouldn't allow for budgetary transfers out of that program. DDA disagreed with this recommendation, but the first House adopted it.
Concur.
Second.
Okay, I have a motion, a second, and a third. That decision is adopted to concur with the House.
On page 72, there's a BRFA recommendation to reduce $16.8 million in general funds in fiscal 21. This would be to recognize federal claiming of the 6% enhanced match that was passed with the Families First Act. DDA disagreed with this reduction, and the first House rejected the BRFA recommendation.
Concur with the House.
Second.
Okay, a motion and a second to concur with the House. Seeing no objection, that decision is adopted.
And then item 4 on page 72, this is a item to reduce $37.8 million in general funds. And that's again to recognize the enhanced Medicaid match from the Families First Act that has just been extended. So it'll go through the end of calendar 2021. DDA disagreed with this. The first House adopted this reduction.
Concur with the House.
Second, but they will have enough funds in their existing allotment, correct? And
This is in anticipation of federal funds coming in, so.
okay, thank you.
I had a motion and a second to concur with the House. Seeing no objections, that decision is adopted.
So then there's two new items for your consideration. The first color page at the bottom of page 72. This is narrative requesting a report on transitioning youth placements. This was also requested last year and DDA has not yet provided this report. So this is just applying it for next year as well.
So I'll entertain a motion on this reminder language.
So moved.
Second,
I have a motion and a second, and seeing no objections, the language is adopted.
So then finally for DDA, the last item for your consideration is on page 74. So this would be language on, again, the enhanced federal Medicaid matching. The new American Rescue Plan provides a 10% enhanced match on home and community-based services. So you also heard this with Andrew with BHA. So this would apply to DDA. It would require them to retain the enhanced match that they receive and that they separately identify this in their accounting. And then it also provides some allowable uses of that funding. You can see that with the at least 75% language that determines some of the allowed uses. And then on page 76, that outlines reporting requirements. And this language would withhold some funding until DDA submits a report on both the 10% and the 6% enhanced matching funds.
move to adopt.
Second.
Okay, I have a motion and a second to adopt that language. Seeing no opposition, that decision is adopted.
Okay, thank you, Madam Chair. For Medicaid, beginning on page 78. Item number 1 is annual language restricting provider reimbursement funding. To that purpose, the agency concurred, the House adopted.
Concur with the House.
Second.
A motion and a second to concur. I've said several different things. The next is procure, but to concur. So seeing no opposition, that decision is adopted.
Item number 2 relates to an action you took last year, which was to send money from the Board of Pharmacy to Medicaid for 2 years. The agency did not include the second year of funding in the fiscal 22 budget, but they agreed that they will do that, and that's at $750,000 general fund reductions, and the House adopted the cut.
With the House.
Okay, a motion and a second to concur with the House. Seeing no opposition, that action is adopted.
So item number 3 relates to the boost funding, and this is just a cut that happens in Medicaid depending on what happens on the boost program. Since we don't know what the decision is on the boost program, you just probably want to hold this item and then just conform to whatever happens in the subcommittee or full committee, wherever that decision is taken.
Okay, move to hold.
Okay,
Item number 4 is a reduction in general funds for non-emergency transportation. This is not a cut in the program, but rather our estimate of the amount of federal funds that will actually be attained. We think the program will attain more federal funds than is budgeted, which will reduce general fund need. The agency disagreed, but the House adopted the cut.
Adopt. Concur with the House.
can I get a second?
Second.
Okay, item number 4 is motion and second to concur with the House. Seeing no opposition, that action is adopted.
Item number 5 is reducing funding by $77 million in fiscal 22 based on expenditure trends. The agency concurred and the House adopted the cut.
Concur with the
Concur
House.
with the House. Second.
Motioned and seconded, that concurrence is adopted.
Moving on to page 79, and item number 6, this is reducing general funds by $244.6 million. Again, this is based on the enhanced 6.2% match being available throughout the calendar 21, which the governor didn't know when he put the budget in. The agency concurred, the House adopted the cut.
Concur with the House.
Second.
Moved and seconded With no objection, the concurrence is adopted.
Item number 7 is technical, and again, it relates to that boost cut. And given your previous action, you probably just want to just go ahead and hold this one.
Okay, move to hold these.
Second.
Done.
Okay, moving to page 80. Item number 8 is narrative that was recommended by DLS concerning the risk corridor settlements in the, for MCOs. The agency concurred with this narrative and the House adopted.
Concur with House.
Second.
Okay, motion and second to concur with the House. Seeing no objection, that action is adopted.
At the bottom of page 80, continuing to page 81, is language asking the department to look into possible shared savings arrangements with Medicare so that we could help fund slot expansion in home and community-based services. The agency concurred, the House adopted the narrative.
Concur with House.
Second.
Okay, it's been moved and seconded to concur with the House. Seeing no objection, that concurrence is adopted.
Item number 10 is language, again, restricting funding in the Children's Health Program to that purpose. The agency concurred, the House adopted.
Concur with the House.
Second.
Okay, it's been moved and seconded on the concurrence with the House. Seeing no objection, item 10 is adopted.
So beginning on the bottom of page 81 and continuing to page 82 are various items for the funding of the Community Health Resources Commission and the Senior Prescription Drug Assistance Program. As introduced, the BRFRA would have made the Senior Prescription Drug Assistance Program funding a floor rather than a cap, and reversal for the CHRC. This would have been a reduction of $4.4 million in funding for the CHRC. The House rejected that item, and instead, on the top of page 82, they adopted a plan that would give the Senior Prescription Drug Program an additional amount of funding, but not as much as was the governor was thinking of in the budget. It would give the CHRC an additional $2.5 million, but it'd still be a $1.9 million cut in fiscal 22. That was the House decision. Below that is a Senate proposal on the same idea. It's the 8 Senate Alt. And what this proposal is to restore the CHRC minimum funding level in fiscal 22 at $8 million, and authorize the use of the exchange reinsurance fund to support the Senior Prescription Drug Program in fiscal 22. We estimate that would cost about $1.9 million in combination with their existing fund balances to fully support that program in fiscal 22. The proposal, though, is also that beginning in fiscal 23, that the Care First premium tax exemption funding, which is what supports these programs, be used only to support the Senior Prescription Drug Assistance Program, and that for fiscal 23 and 24, you divert revenue that would have gone into the reinsurance fund to the CHRC at $8 million in both 23 and 24. So it guarantees the CHRC funding in 23 and 24, and it also basically guarantees the Senior Prescription Drug Assistance Program. And there's a couple of technical changes that go with that as well, just to kind of like clarify that the Medicaid and the Senior Prescription Drug Assistance Program can be funded using the actual reinsurance fund. So that's the kind of Senate proposal that's on the table. And I think the idea here is to make sure that the CHRC gets its $8 million, both in 2022 and in 23-24. And it gives you some time to think about what a permanent funding solution would be for these two programs, because they can't coexist using the existing revenue stream.
So just to play that back, the Senate proposal will still ensure that both the CHRC and the Senior Prescription Drug Program are funded at their current level of need.
Correct.
Okay.
Yeah, you said that in about 3 minutes less than I did, but that is absolutely correct.
That's good. And then there are 3 decisions, right?
Not really. If you just adopt the Senate decision, you're okay.
Take
All
care.
right. Well, yeah, but we have to concur with the House on 8, right? And then we
Correct.
reject 8 DLS alt, and then we'd adopt our package.
That's right.
Got it.
Is that a
Move
motion?
it. Yes, a motion, yeah.
And I second it.
It's been moved and seconded to do what he said, what she said. All right. Seeing no objection, the Senate proposal is adopted.
Excuse me.
And top of page 83, this is just a technical amendment relating to the Senior Prescription Drug Assistance Program. And despite the changes that you've made, this amendment still works. So I would recommend you just adopt the House decision.
So
Concur with the
moved,
House.
concur with House. Yeah.
Have a motion and a second to concur with the House, and seeing no objection, that decision is adopted.
Okay, recommendation number 12. This was a deficiency, fiscal 21 deficiency recommendation to cut 75 million out of the Medicaid budget based again on service utilization trends, expenditure trends. The agency concurred and the House adopted the cut.
Concur with the House.
Second,
Okay, a motion and a second to concur with no opposition. That concurrence is adopted.
Number 13 is to cut another $37.3 million out of the fiscal 21 deficiency, recognizing available fiscal 21 enhanced federal match. Actually, this enhanced federal match is based on match we should have claimed in fiscal 20, but we didn't. But this kind of like trues up the fiscal 20 enhanced match. The agency concurred with this reduction and the House adopted the cut.
Okay. Concur with the House.
second,
And it's properly moved and seconded to concur with the House, seeing no objection. That decision is adopted.
The House made one additional action, which was to add narrative on collaborative care pilots. These are pilots that were essentially what you try and do is talk about the delivery of behavioral health in primary care settings. This is not necessarily specialized mental health treatment, but more less serious behavioral health treatment. There's a 4-year pilot taking place, and this basically asks for an update on how that pilot's going. And the House, as I said, this is House adopted narrative.
great, concur with the House.
Second.
Okay, with a motion and a second and no objection, that action is adopted.
Okay, moving to page 84. The additional House cut there, number 2, relates to the BRFA item, which is right underneath it. Essentially, the governor was proposing to increase the Medicaid deficit assessment in fiscal 21 and beyond by $35 million. The budget included contingent action in both 21 and 22 based on that BRFA item. As you can see, the House rejected the $35 million increase. And as a result, you have to then adopt number 2, if you agree with the House, to actually cut the available special funds from the deficit assessment. So that's how those 2 actions work together.
Okay. Concur with the House on both items.
Second,
Okay, have a motion and a second to concur with the House and adopt the language without opposition. Those actions are adopted.
Okay, I think the last action for Medicaid is beginning on page 84 is an additional color page item. It kind of goes, the meat of it goes down to page 85. And again, this relates to the enhanced match for Medicaid home and community-based services in the recent American Rescue Plan. It's again, as Anne and Andrew described, we're asking for certain reports to make sure that we get information on how much enhanced match is claimed. But as with Anne's language, this language also basically says that 75% of the funding should be used for a one-time rate increase for home and community-based service providers who are eligible to get that rate increase. The rest of the money is essentially can be used for waiver slot expansion or anything else the department wants to do to enhance, strengthen, or expand community-based home and community-based services. So that language runs all the way through, actually through page 87.
move to adopt.
Second,
Okay, a motion and a second to adopt without opposition. That action is adopted.
Thank you very much.
Thank you.
Thank you.
The Health Regulatory Commissions begin on page 88. The House modified the DLS recommendation here on the Maryland Primary Care Program to include a consideration of that program, not only from the cost effectiveness, but also the racial equity in terms of both participation on the provider side as well as on the patient side.
Concur with House's modification.
Second.
Thank you. I have a motion and a second to concur with the House, seeing no objection, that action is adopted.
On page 89, the House added or essentially had to amend the contingent reduction on the Community Health Resource Commission because they did take that DLS position. To be consistent with y'all's prior actions discussed in Medicaid to fully fund the Community Health Resource Commission, y'all just want to strike this entirely.
Okay. Move to strike the contingent language.
Second.
Okay, motion and a second to strike that contingent language without opposition. That action is adopted.
That was which page?
Yep. 89.
89,
Got it.
the
Got it.
first,
Nope.
first side.
I'm with you. Thank you.
And then lastly, for the health department, on page 90, we do have an additional item for your consideration. This is narrative around the hospital at home model. Due to some additional flexibilities that were given under the pandemic, there's been additional ways to provide care. And so what this does is ask both the Community Health, or pardon me, the Health Services Cost Review Commission and the Maryland Healthcare Commission to sort of look at this model in particular. It has a due date of December 1, 2021.
Move to adopt. Sounds good.
Okay. Second.
I have a motion and a second to adopt the narrative on page 90, seeing no objection, that action is adopted.
Okay, moving to Department of Human Services on page 91. The first is administration. And the first DLS recommendation is to adopt annual language referring funds for the Maryland Legal Services Program to that purpose. The agency concurred and the House adopted.
With the House.
Second.
Okay, motion and a second to adopt, and that action without opposition is adopted.
The second DLS recommendation, starting on page 91 and going on to page 92, DLS recommends adopting narrative requesting periodic updates on the MD Think major IT project. The agency concurred and the House adopted.
Concur with the House.
Second.
Motion and a second on that item number 2, seeing no objections, that narrative is adopted.
The third DLS recommendation is to adopt narrative requesting a spending and development timeline be submitted at the beginning of the fiscal year for the MD Think major IT project. The agency concurred and the House adopted.
Concur with the House.
Second.
And moved and seconded without objection, that concurrence is adopted.
The final DLS recommendation is to restrict funds in the Department of Human Services, the Department of Information Technology, and the Department of Budget and Management pending a report on cost estimates that all 3 agencies agree pertaining to the MD Think major IT project. The agency didn't respond, but the House adopted.
Concur with that.
Second.
Okay, motion and a second to concur with the House on yet another item that the subcommittee spent a little time on. So seeing no opposition, those actions are adopted. Right?
We're due a lot of reports.
A lot of reports. Okay.
Actions related to the Social Services Administration begin on page 95. The first recommendation was to restrict funds pending a report on hospital stays, emergency room visits, and placements after discharge for youth in DHS custody. The agency agreed to provide the information, but disagreed with the restriction of the funds the House adopted.
So concur with the House.
Second.
Motion and a second to concur without opposition, that concurrence is adopted.
Recommendation 2 starts on the bottom of page 96 and continues on to page 97. This is committee narrative that requests information on the implementation of the Family First Prevention Services Act. The agency concurred and the first House adopted.
Concur with the House.
Second.
Okay, motion and a second to concur with the House without opposition, that action's adopted.
Recommendation 3 on the bottom of page 97 is annual language restricting funds for the foster care maintenance payments program to that purpose. The agency concurred and the House adopted.
Concur with the House.
Second.
I have a motion and a second to concur with the House, the agency, the recommendation. Without objection, that action is adopted.
On page 98, recommendation 4 was a committee narrative that requested information on the implementation of the new foster care rate structure. You may recall from the hearing that the agency's timeline had been delayed a little bit from the report you received in the fall. So the House modified the language that begins on page 98 and continues on page 99. Basically, the change is looking for information on the procurement of the actuarial services, which is where the delay is currently, and an updated timeline, as well as how they're working with the Department of Health on those actuarial services and the timeline for submitting the Medicaid state plan amendment.
Concur with the House modifications.
Second.
Motion and a second to concur with the House modification. Without objection, that action is adopted.
On the bottom of page 99 and continuing on to page 100 is recommendation 5, and this is committee narrative that requests information on the foster youth savings program and the savings, the conservation of funds of the federal benefits that they receive on behalf of youth in state custody. The agency concurred and the House adopted.
Concur with the House.
Second.
The motion and a second to concur. Seeing no objection, that action is adopted.
On the top of page 101, recommendation 6 is the annual language that restricts the funds for the child welfare services to that purpose. The agency concurred and the House adopted.
Concur with the House.
Second.
Okay, motion and a second on that item. Without objection, that action is adopted.
Recommendation 7 that begins on page 101 and continues on to page 103 is mostly annual narrative that requests information on the child welfare caseload, but it also adds an additional request about their efforts to fill vacant positions in Baltimore County and Prince George's County, which are the two places where they still kind of have shortfalls in the number of caseworkers. The agency concurred and the House adopted.
Concur with the House.
Second.
Motion and a second to adopt a concurrence on item 7. Without objection, that action is adopted.
Recommendation 8 on page 103 was to delete a general fund deficiency appropriation. This was for a temporary provider rate increase that began in January and continued through June. DLS recommended deleting the funds because we believe there's sufficient funding for that purpose in the budget. The agency disagreed but the House adopted.
Okay. Concur with that.
We need to modify that. Why don't we modify
Oh, no.
that and reduce the general fund deficiency by half?
Yeah, I second that change.
Okay, so there is a motion and a second to modify the House action and reduce the general fund deficiency by half. Seeing no opposition, that action will be adopted.
There was one BRFA item related to the agency. This BRFA item limits the increase in the rates for providers who have rates set by the Interagency Rates Committee to 4% over the rates in effect on December 31st, 2020. That is before this temporary provider rate increase that began on January 1st. So the House modified that action to change the date to January 1, 2021, rather than December 31st.
Definitely concur with House on that one. So they get their full allotment.
There's motion and a second to concur. Without objection, that action is adopted.
On page 104 begins some additional House actions related to the agency. The first is a committee narrative that requests a report on kind of planning and timeline for a workload study.
Concur with the House.
Second.
A motion and a second to concur with the House on the workload study. Without objection, that action is adopted.
The second action applies the annual language restricting the funds for the foster care maintenance payments program to the supplemental budget funding for the program.
Concur with the House.
Second.
Motion and a second to concur with the House. That action is adopted.
Beginning on page 105 and continuing through 107 is language that restricts funds in the Social Services Administration and the Behavioral Health Administration until they submit a report that reviews the voluntary placement agreement process and alternatives to going a child welfare involvement in that process.
Concur with the House.
Motion and a second to concur with the House. Without objection, that item is adopted.
Moving to the Child Support Administration on page 108. The first DLS recommendation is to adopt narrative requesting periodic reports on child support services performance. The agency concurred and the House adopted.
Concur with the House.
Second.
Motion and a second to concur. Without objection, the concurrence is adopted.
The second DLS recommendation is to adopt narrative requesting data on TCA-related child support cases be submitted with the agency's annual MFR submission. The agency concurred and the House adopted.
Concur with the House.
Second.
It's been moved and seconded to concur with the House. Seeing no objection, that action is adopted.
And the final action for this budget unit is the House adopted narrative requesting a report on state enforcement measures and data. That's on page 110, and then it goes on to page 111.
Concur with the House.
Second.
Okay, it's been moved and seconded to concur with the House. Seeing no objection, that concurrence is adopted.
Page 112 begins the actions for the Family Investment Administration. The first recommendation was to reduce $950,000 in the department that should have reverted in fiscal 2020. The agency concurred and the House adopted.
Concur with the House.
Second.
Okay, seeing a motion and a second and no objection, that action is adopted.
Recommendation 2, which continues on to the next page, requests information on case closures by month and reason for the public benefit programs. The agency concurred and the House adopted.
The House.
Second.
Recommendation and second is to concur with the House position. Seeing no objection, that action's adopted.
I was concurring with my colleague.
We'll take
Recommendation 3 that begins on page 113 and continues on to the next page requests information on the second year of the summer SNAP for children program. The agency concurred and the House adopted.
Concur with the House.
Second.
Okay, moved and seconded to concur with the House. Without objection, that concurrence is adopted.
Recommendation 4 on page 114 is committee narrative that requests that the department and the Department of Budget and Management separately identify the spending related to the pandemic EBT program from the regular SNAP program. The agency concurred and the first House adopted.
Concur with the House.
Second.
Motion and a second to concur with the House on number 4. Without objection, that action's adopted.
Recommendation 5 that begins on page 115 and continues on to the next page requests information on application processing times and the reasons for denial for the public benefit programs. Agency concurred and the House adopted.
Concur with the House.
Second.
A motion and a second to concur with the House on item 5. Without objection, that action is adopted.
Recommendation 6 that begins on page 116 and continues on to the next page requests that the department begin submitting performance measures for the SNAP employment and training program with their MFR measures. The agency concurred and the House adopted.
Concur with the House.
Second.
Okay, the concurrence has been moved and seconded without objection. That action is adopted.
Some additional House actions related to the administration begin on page 117. The first action, which continues on to the next page, requests that the department look at potentially adjusting benefit eligibility levels and income thresholds relate to reduce the benefit cliff, as well as evaluate options for their transitional cash assistance program.
Concur with the House.
Second.
Okay, I have a motion and a second to concur with the House without objection. That action is adopted.
The second, on page 118, requests the agency submit a report on whether the TANF funds can be used to support non-state entities that provide case management and other services to households meeting TANF eligibility, and whether other states do that.
Concur with the House.
Second. Excuse me.
Okay, that's item 2. I'm sorry, I got
Yes, item 2.
getting happy highlighting and lost my place. Okay, I have a motion and a second to concur with the House on item 2. Seeing no objection, that action's adopted.
On the third action that begins on page 119 and continues to page 121, restricts funds from a variety of agencies to submit a report describing their current coordination and efforts to simplify and the documentation and the application process and coordinate the documentation.
So can we modify that to clarify that DHS is the lead agency and responsible for pulling that information together and getting the report? Is that?
Yeah, you can do that.
Can we do that? Okay.
I second that.
Okay, there's a motion and a second to modify, to clarify, and to indicate that DHS is the lead agency for completing that report. Without objection, that recommendation and action are adopted.
If you move ahead to page 122, these are the actions for the Office of Home Energy Programs. The first recommendation is committee narrative, requesting information on application processing times and denial rates. The agency concurred and the House adopted.
Concur with the House.
Second.
It's been moved and seconded to concur with the House without objection. That decision is adopted.
The second recommendation that begins on page 123 and continues to the next requests information on the implementation of administrative and programmatic changes that they're considering, including implementation of categorical eligibility and moving into the new eligibility and enrollment system. The agency concurred and the House adopted.
Concur with the House.
Second.
Okay, with a motion and a second to concur with the House without objection, that action is adopted.
That's,
Madam Chair, if you move to page 125, I'm going to pinch it from my colleague Emily, who is in another Zoom meeting in the ether somewhere. So the first recommendation from DLS was to actually get some narrative on the educational broadband network. This was funding in the original CARES Act,
Right.
to improve broadband connections especially in relation for kids in schools. The agency concurred with this narrative and the House adopted it.
Concur with the House. Yeah.
Second.
Okay, so I have a motion and a second to concur with the House on item 1 without objection. That action is adopted.
At the bottom of page 125 and continuing to 126 is some additional first House actions. This is narrative for folks in low-income housing tax credit properties and about how they can submit complaints.
Concur with the House.
Second.
Okay, it's Properly moved and seconded to concur with the House. Seeing no objection, the item is adopted.
And the last item at the bottom of the page is, this is a suggestion to add additional narrative to get a better understanding on broadband availability across the state. I mean, broadband is going to be a huge issue, not only in Maryland, but nationwide. There's going to be a significant amount of funding available, I think, for this, not only maybe in the state, but also at the national level. So getting a sense of what you're actually doing in this area is probably a very good idea.
Yeah, and DHCD is willing to do that, so I'd move to adopt that language.
Second.
And there is a motion and a second to adopt that item without objection. That decision is adopted.
Great. I think that's it, right?
Yes, that concludes the document.
No more color pages?
No, did you not have enough?
Well, they were all white this year.
I have some crayons if you want to color some.
There we go.
Well, let me just thank everyone again. This has been a tremendous amount of work this session. We had, as Senator Eckert mentioned, we were able to work with our colleagues from the House Subcommittee and move through the hearings with information provided by the analysts. And so these decisions today will be our recommendations based on a lot of work done behind the scenes by our staff and the analyst and each member of the subcommittee. Please receive my thanks with the spirit that they're intended, which is heartfelt. It's hard working apart from one another this session, but we've managed to get it done. So I just want to thank each of you so much and say that we are not done yet. We present to the full committee, Philip, on tomorrow. Oh,
Yes, subcommittees report to the full committee tomorrow.
right. So we'll hear from our colleagues in the other subcommittees and defend our decisions today. And then once we make it through that process, we'll head to the floor. But certainly for those who are watching, those advocates and those who have spoken up at our hearings or testified at our hearings and contributed to the work product that we have produced today, we want to extend thanks to each of you for taking the time to be a part of our process. We know it's been different this year, but we have had a lot of community participation and it has enhanced our work. So we want to thank you all so much for the calls, for the emails, and for your testimony in our hearings, and look forward to working with you all in the coming days and weeks. So with that, members, does anybody have anything to add?
No, thank you, staff. Thank you, DLS. Thank you, Madam Chair. Good job.
And I was just going to say, great staff that someday I hope to get to meet.
Thanks,
Mr.
everybody.
Thanks. And let me just thank again and applaud Senator Ron Young, whose first year on the subcommittee was remote, and he jumped in and really helped us out this year. So thank you so much. And thank you, everyone. That's it.